I'd like to talk regarding the synovitis. Serositis, then synovitis. I'm talking about the synovitis. Can you write down the synovitis here? SLE synovitis and RA synovitis also. Rheumatoid arthritis. Can you remember? Can you memorize the word the rosing? Yes, rheumatoid arthritis is a rosing migraine. Rosing means erosions will be there. And rosing leads to the distracting, deforming arthropathy. Can you remember? In contrast, the SLE synovitis is a non-erosing, non-distracting, non-deforming arthropathy. That's the basic differences in between the SLE synovitis and rheumatoid arthritis. Okay. Rosing, distracting, deforming, non-erosing, non-deforming, non-destructing, non-deforming arthropathy. But one of the message, once again, on the top, I have written. There is an exception, make it star. You can write down here. I have no space here, so that's why I've written here. One of the SLE arthropathy, we call it Jacquard's arthropathy. It's basically the severe form of synovitis. Severe form of synovitis. That's called the Jacquard's arthropathy, which looks deforming arthropathy. Can you write down the deforming arthropathy? Which is a deforming arthropathy. It looks like this. Just look at me. Deforming arthropathy. Very look like to be a rheumatoid arthritis deformities. But the difference is in between these two deforming arthropathy. This is also RA deforming arthropathy, and this is SLE deforming arthropathy. The difference is when you feel the hands, SLE hands will be the soft, supple, and reversible minded. Are you getting me? মানে আপনি দেখবেন যে সফট লাগবে হাত না অত এরকম শক্ত হয়ে থাকবে it will not be stiff enough, destructive and deforming arthropathy. It's not the RA mind. RA is like this, very stiff enough, but here it will be soft, supple, and reversible. That's the clinically at the bedside that you can differentiate. But if you look at any photograph of both these deforming arthropathy, sometimes it is difficult. So that is the basic differences in between this SLE synovitis, severe form of synovitis, deforming arthropathy, which is reversible, and which is irreversible in case of RA. So let's get back once again the neuro and nephro. Yes. The neuro and nephro, hematoimmuno, and ANA positivity. Yes. So once again, let's talk about the SLE. Yes, one of the message. That is the SLE immunological criteria, including ANA. Can you write down the ANA, DINA, INA? Even though if you have gone through this, ANA, DINA, INA, ASHA, APAS, my dear. All APAS, you see the ANA, DINA, INA, all the sisters, all the APAS. And ASHA is also as well in APAS. ANA, DINA, INA, ASHA, APAS. Can you say with me, ANA, DINA, INA, ASHA, APAS. ANA, DINA, INA, ASHA, APAS.
INA, ASHA, APAS. INA, DINA, APAS.
ANA, DINA, INA, ASHA, APAS.
INA, DINA, INA, ASHA, APAS.
Yes. What is ANA really means? ANA is the most sensitive antibody. Can you write down this is important message? And ANA staining pattern. Can you write down homologous? Can you remember? Homologous, homogeneous staining pattern is a lupus, my dear. DINA means double strength DNA antibody is a more specific antibody. Can you write down? And INA means extractable nuclear antigen antibody, which is nothing but anti-Smith antibody, ASHA, which is the most specific antibody. And last is the APA means anti-phospholipid antibody. Usually, sometimes in a short forms, people are writing APLA. I said them APA. Yes, my dear. So from this box, definitely one questions you'll get, my dear. Every time, the questions will be here. People are doing mistakes, even though it's easy questions. Every easy question is the difficult questions. If I ask Dr. Sultana, could you please tell me your name? You get stuck for 3 seconds. Why he's asking? You are asking yourself, why he's asking my name? So the easiest question, you get stuck and you get confused. So similarly, say for example, they will give a scenario like, say for example, 23-year-old lady present with a pleuritic chest pain, having some of the joint pains, butterfly rashes, and ANA is positive, double-stranded DNA positive, and diagnosis done, the SLE. Now the GP referred to the rheumatologist to start the treatment. That's the scenario. Now the question, which one of the following antibody is the most important antibody to make the diagnosis? So I'll tell you, my dear, you'll get definitely wrong, everyone. So let's just get it out. The most sensitive. ANA is the most sensitive antibody, and also can you write the most important antibody? Important. Can you write now? And I said to you on the last class, is a life-saving antibody. Test, my dear. Because the most sensitive is enough. I need only the one criteria. I don't need anything more. Immunologic card, say for example, DINA negative, INA negative, A plus negative, not issues. I have the photosensitivity rash. I have the butterfly rash. I have the oral ulcer, 3, and ANA positive is 4, done. Diagnosis done. Why you are worried about? The antibodies should be positive. So the most important antibody is ANA, number 1. Okay, the question is asking most specific antibody. Yes, INA, definitely. Most specific. So everyone usually gives the wrong answer when it is said that the most important antibody to diagnose the SLE. The answer option, ANA, DINA, INA, ASHA, plus 5 options. Which one is the answer?
ANA.
ANA. I said ANA, not the ASHA. Be careful about it. Be careful. And this is the very twist questions is asking, but very important curriculum for us to make the diagnosis. That's why the practical question is not just a question, my dear. Like back home, that the questions are made just so that the candidates are unable to make the answer, right? আমাদের দেশে কি হয় কোয়েশ্চেন বানানো হয় যেন ক্যান্ডিডেট না পারে নাকি yes but yes this is the most practical question I'm telling you. So the most important antibody, if it is the question is asking, ANA. Most specific antibody for diagnosis, definitely ASHA, no doubt. Most sensitive antibody, ANA. Yes, DNA, double-stranded DNA is a more specific, definitely more specific. But these are the two confusing questions are hitting in the exams like that. Most important to diagnose, most specific to diagnose. Specific and important, be careful about it. Do you understand what I'm saying? So just break it down. Thank you very much. So this is the immunological test that we do, the ANA, DINA, INA, ASHA, PAS, and definitely, yes. Not this one, yes. So this is the SLE, man. This is the SLE that we talked about. Yes. Yes. So one of the important disease that I'm talking about now, yes, that is, just wait. I'd like to do. Yes. Yes. So one of the important discussions, that is the acute monoarthritis, a very hot topic for the, yes. And definitely you'll get a one question, Smiley. Definitely one. Maybe more than one as well. Acute monoarthritis. But before going to the acute monoarthritis, yes, Dr. Mohiuddin will give me the 4, 2, 2, 2, 2, and one last criteria for AC. Butterfly rash, photosensitivity, Dr. Mohiuddin, bolen.
Butterfly rash, photosensitivity, oral ulceration, DLE, serositis, synovitis, neuro, nephro, hematoimmuno, and anapathetic.
Lovely, fantastic. I'm so happy. Thank you very much. Dr. Shammi.
Butterfly rash, photosensitivity, DLE, oral ulcer, serositis, synovitis, neuro, nephro, hematoimmuno,
and Ana positive. Fantastic. And Dr. Khatija, can you say me the immunological? Anadina ina shafas. Dr. Khatija Zamila. Dr. Khatija Zamila.
Actually, Ana Dina, Ana Apas, Asha Apas. Ana Dina, Ina Asha Apas.
Ena mane ki?
Ana holo extractable nuclear antigen.
No, Ana is anti-nuclear antibody, homologous, more sensitive antibody. Yes, এই কথাগুলো ফেরত দিতে হবে আমাকে। বলেন আনা anti-nuclear antibody.
Ana anti-nuclear antibody. Homologous. Most sensitive antibody.
Most important antibody. দুইটা কথা লিখে রাখতে হবে। Most sensitive / most important antibody to diagnose SLE. Means for making the diagnosis of SLE, which antibody will be most important? That's the questions in a different ways. Guriye pichiye kintu questions will be encountered in exams. Got it? Dr. Umme Salma, Ana Dina Ina Asha Apas, bolen.
Ana Dina Ina Asha Apas. Ana anti-nuclear antibody, most sensitive and most important test for diagnosis. NPDS DNA, more specific antibody.
More specific.
Ina anti-Smith.
More specific.
More. Yes, more specific. Ina anti-Smith antibody. Asha, most specific antibody to diagnosis, and anti-phospholipid
antibody. Fantastic. Thank you very much. Thank you. I'm happy for that. Now I can move forward. Yes. Can you write down the acute monoarthritis? Yes. Acute monoarthritis. So the way I'm writing, I mean, the new doctor joined today and in this batch as well. The way that I'm writing, I mean, copy paste for me. All right, that will be helpful. All right, so just follow me, my dear. Just copy and paste me. Yes, acute monoarthritis. Acute means sudden onset. Mono means single. Joint inflammation. Right? Very simple. Sudden onset, single joint inflammations. Right? This is called acute monoarthritis. No need to write. So the most common is the knee joint. Can you write the knee? Say, for example, I'm going the right knee. It can be left knee. It can be right knee. It doesn't matter. Okay. Right knee joint. Say, for example. So what will be the results of the inflammation? Acute inflammation. We know the acute inflammation, A for acute. There is another lecture. I say the A for exudate migraine. Means there will be the pus. Banglai pus bolen na? Pus, PUS, pus and pus. Yes, my dear. So there will be the pus or pus is the outcome of the acute inflammations. So if the acute exudate is accumulated in the right knee joints, what will be happening? It will press over the capsules that leads to the pain, definitely the pain. Plus tenderness, if you push your hands because the inflammation is going on the tenderness. Arthralgia means pain. Arthritis, the pain and tenderness, at least I'm telling you. And definitely because of the pus and pus is there, definitely there will be swelling. So pain, tenderness, and swelling. Not only swelling, because the pain, tenderness, and swelling is there, you cannot move the joints. Color, dolor, rubor, can you remember? Functionalgia, the acute inflammations, the pathology. So the results of everything. So pain, tender, swelling, and unable to move your right knee joint. That's the complete picture should be there for an acute right knee monoarthritis. Unable to move. So the question is, what you'll do next? What next to do? That's the scenario will come definitely to your exam assignment. Because as a resident doctors, you are the first doctor attending the patient's mind. Believe me, in the hospital, even in Bangladesh, right? You're the first doctor attending your patients. You take the history, you examine the patient, you make your decisions, then you escalate to the seniors. So what happened? So you need to take the right decisions. Next to do. That's the things actually the part 1 target. And because after MRCP, you will be the registrar. Similarly, you will be the attending doctor. You will be the decision maker. You have to make the decisions. So here's what next to do. The next to do is aspiration, joint aspiration. You need to aspirate the collections, the fluid, the exudate, the pus and pus from the joints. And that is the state is every diet is coming my dear. Because in your working place, you'll get this patient mind. You need to make preparations for aspiration of the knee joints. But beforehand, then we need to think, right, what's going on? So what's going on, the way that I've written, yes, whenever the acute monoarthritis is coming, the first diagnosis in your whole life, septic arthritis. Number 1, septic arthritis. It's a box. Septic arthritis, and septic arthritis. The first diagnosis to consider and first diagnosis to exclude. Before saying that the second and third diagnosis. Second diagnosis, acute gout. Third diagnosis, pseudo gout. And last, number 4 is a hemarthrosis. Hemarthrosis means heme means blood. Collections within the joints. Hemarthrosis. In hemophilia. It can be trauma, but trauma patients are not coming to your mind. You are a medicine specialist. You will be dealing with all the medical cases. When the patient comes to the ED doctors are there, the emergency doctors. Emergency doctors are segregate the patients, and whenever they think it is a medicine case, they will discuss with the med-reg, medical register in the ED from our team, from the acute medicine department. Then the medical register, as you, after your MRCP, you will decide, you will accept the patients or not as a medical patients. So that's the way that the things are working here. So what you need to do is consider in your brain, acute monoarthritis means septic arthritis, acute gout, pseudo gout. Within these 2 box, acute monoarthritis means, say with me, septic arthritis, acute gout, pseudo gout, and lastly, hemarthrosis. Salma, can you say me these 4 diagnoses?
Septic arthritis, acute gout, pseudo gout, and hemarthrosis.
Fantastic.
Then-
Thank you very much.
Yes,
Thank
thank
you. Thank you very much. Yes. Thank you very much. Will do. Dr. Rumana Jahan Dina. Dr. Dina, can you say me the 4 diagnoses?
Septic arthritis, acute gout, pseudo gout, hemarthrosis.
Fantastic. Jessica. Dr. Jessica. Dr. Jessica.
Septic arthritis, acute gout, pseudo gout, hemarthrosis.
Fantastic. Thank you very much. So yes, my dear, I'm telling you the question is out. I'm telling you, লেখা রাখেন আপনারা out. Question থাকবে পরীক্ষায়। মজা পাবেন। The স্যার কইছিল out. Yes. Every diet. Because the RCB targets to make the peoples to do the jobs. Practical jobs. Practically you do work rather than just a big knowledge in your brain. মানে এত নলেজের দরকার নাই, কাজ করতে পারলে হলো, পেশেন্টকে বেনিফিট দিতে হবে, বুঝতে পারছি, to give you the benefits to the patient's mind. So here's the what next to do. Aspiration is the first things, my dear. What will be the benefits to the aspirations? That's important. If you take the fluid out, pain will be reduced, tenderness will be reduced, swelling will be reduced.